The big headline today about health and something we all have in our medicine cabinets, an encouraging possibility that aspirin could be a weapon in the fight against cancer. ABC's Lisa Stark on the news that could affect everyone tonight.
It's a daily ritual for millions of us. Nearly a third of middle-aged Americans regularly pop an aspirin to help prevent heart attacks and strokes. But these new studies strongly suggest this simple pill may also protect against another killer.
This is the largest body of evidence that suggests there may be an effect of aspirin on reducing cancers.
We already knew aspirin cut the risk of colon cancer. Now many other cancers may be added to the list, including stomach, lung, prostate, uterine, and ovarian. Those who took an aspirin every day appeared less likely to get cancer, to have their cancer spread, and to die from cancer.
The study suggests it takes years of daily aspirin use to get an anti-cancer benefit. If you're on a low dose, at least 5 years, and even on higher doses, 3 years of a pill every day.
Doctors warn the research is not conclusive. Other studies with people who took aspirin every other day showed no cancer benefit. And aspirin can have toxic side effects, including internal bleeding. But today's research brings us tantalizingly closer to determining if this age-old wonder drug may be a modern miracle worker. Lisa Stark, ABC News, Washington.
And I want to bring in Dr. Karen Latimer, who consults with ABC News on health issues. Dr. Latimer, let me get this straight because this is astonishing news to a lot of people. If you're taking a low-dose aspirin, it can take about 5 years for the benefits to kick in, according to this study.
That's right.
Take a full aspirin, it takes 3 years to kick in, right?
That's absolutely right. That's what this study is showing us. And it's also showing us that people who take an aspirin every other day, there's no benefit.
So you really have to take it every single day, but doesn't that have effects on your stomach? Stomach bleeding is one of the risks, isn't it?
Well, certain people should certainly not be taking aspirin, but the risks do include bleeding, as you mentioned, not only with the stomach, but intracranial bleeding. And a very small percentage of people who are taking aspirin will, in fact, experience these adverse risks.
And taking aspirin with food doesn't prevent that consequence. So number one thing is go and ask your doctor. And make sure you don't start this before you've asked your doctor.
Absolutely. This study should not make people run out and buy aspirin and start taking it without talking to their physician. There are many reasons not to take aspirin.
Well, this would really be amazing news if something we all have in our medicine cabinets could have an effect on cancer prevention. Thank you so much, Dr. Latimer.
You're welcome.